principal purpose of the stay-at-home order was to make sure that fewer people got sick and fewer people would die than would otherwise without a stay-at-home order. And as you're suggesting in the last part of your comments, the curve gets pushed out when you do that, pushed down, and that's good because as you're trying to build capacity, you're trying to raise the line, that you don't want to go above, right, of how many beds do you have, how many ICU beds do you have, how many ventilators do you have. You want to raise the line so that you can fit all of the patients and the needs underneath that line of capacity, let's say. And you want to continue to make sure that wave of patients doesn't go above the line. You don't necessarily need to continue to build capacity, right? We can't build out 4 more McCormick places. But what you want to do is make sure that the number of people who get sick is kept down. And so that's really the purpose of a stay-at-home order. It was the purpose of the original, canceling of, as you may recall, canceling of, the parades and St. Patrick's Day parades, and then closing of restaurants and bars. So that's what I think people need to pay attention to now. Obviously, the better we do at this, right? The better we do at this, the more likely it is that we can start to think about, okay, what are the safe ways to begin to reopen things so that people can go back to work, people could go back to school? Are there ways to do that keep people safe? Some of the things we've suggested already, like everybody wearing a mask, are some of what's one idea among a bunch that will help us